Dear students, welcome back. In the previous session, we have discussed about osteokinematics of knee joint. Now, in this session, we are going to discuss about arthrokinematics of the knee joint, that is flexion and extension. Now, during flexion and extension, if tibia is fixed here, then what will happen? What are the intra-articular articulations? Now we will see. The large articular surface of the femur and the relatively small tibial condyle create potential problem as the femur begins to flex on the tibia. Okay, if the femoral condyles were permitted to roll posteriorly on the tibial condyle, the femur would run out of the tibial condyle before much flexion had occurred. This is the problem. So that means, once this femoral condyle, large femoral condyle, starting rolling on the tibial plateau, what is happening? So after reaching some degree of flexion, then this condyle, femoral condyle, may reach to the tip of this tibial condyle, and if furthermore rolling occurs, there may be a chance of we can call it as slipping of this femoral condyle from this tibial condyle. This should not be occur. Okay, so if or otherwise further rotation is not taking place after this, then the flexion movement is limited up to here only. Then what to do? So then what happens after reaching this rolling? Normally here this rolling may end up from 0 to 25 degrees. So after that, the femoral condyles is going to glide anteriorly. So next, after reaching here, the femoral condyles are going to glide anteriorly. You can see in this thing. So with the simultaneous rolling as well as gliding anteriorly helps in full flexion of the knee joint. Okay, so this is going to happen. Okay, so as flexion continues, the rolling is accompanied by a simultaneous anterior glide, which is just sufficient to create nearly pure spin of the femur. Okay, which causes the posterior displacement that would occur with the rolling of the condyles, which is offset by the magnitude of anterior glide, resulting in the linear displacement of the femoral condyles after 25 degrees of flexion. Okay, yes. So this is the thing happening after it is reaching 25 degrees. Okay, yes. So in the case of extension, so the same opposite movement is going to takes place in the case of extension. From full flexion, if extension has to take place, so now the femoral condyle has to roll anteriorly. It has to roll anteriorly simultaneously with posterior glide. After reaching some point of this posterior glide, again it rolls anteriorly to complete the extension. Okay, so this is the thing happened when the tibia is fixed and this femur is rolling and gliding during flexion and extension. Okay, so and also the tibia is also capable of moving on a fixed femur. For example, during a seated knee extension, that means when we sit on a chair and we can able to extend the knee, isn't it? That means we are moving the tibia. Okay, like this when we are in sitting position. So then what the person will extend the knee. Okay, so the person will extend the knee. Okay, so this what will happen here, the tibial compartment is going to move. Okay, on fixed femur, when the person is sitting here, the femur is fixed. And also on the swing phase of gait. So when the person is moving in the gait cycle, we can study the swing phase very in detail. Okay, in this case the movements would be somewhat different. Okay, when the tibia is flexing, when here the tibia is flexing on fixed femur, the tibia both rolls and glide posteriorly on a relatively fixed femoral condyles. So what is happening here? The tibia, when the tibia is flexing on a fixed femur, so here now it is starting flexing, then what it is going to happen? Normally we know that concave-convex rule, isn't it? Here the concave surface is moving on the convex, then the movement is also in the same direction of the lever. Okay, now so this concave surface is moving on the convex side, then if it is flexed means it has to move posteriorly, isn't it? So then what will happen intra-articularly? The tibia both rolls and glides posteriorly only on the fixed femoral condyles, and the extension of the tibia on a fixed femur incorporates the anterior roll and glide of the tibial plateau on the fixed femur. This is the thing happening when this tibia is moving on the femoral condyle. Here we have to use concavo-convex rule. The same thing is happening that when the convex surface is moving on the concave plateau, the opposite movement is going to taking place. Okay, yes. So this is the thing happening, the arthrokinematic, the intra-articular motions during flexion and extension. And next thing you have to consider in this is the cruciate ligaments and menisci. So this cruciate ligaments and menisci is also having a role in flexion and extension. Okay. So the arthrokinematics associated with tibiofemoral flexion and extension are somewhat dictated by the presence of this cruciate ligaments. If the cruciate ligaments are assumed to be rigid segments with a constant length, posterior rolling of the femur during weight bearing, okay, posterior rolling of the femur during weight bearing knee flexion, would cause the rigid anterior cruciate ligament to tighten. So this is the thing. So here in this movement, so what is happening during the flexion, the femur is moving posteriorly, then what is happening? So the anterior cruciate ligament is going to be taut, and which serve as a checking point to limit the movement. So continued rolling of the femur would result in the tightness of anterior cruciate ligament simultaneously, which is creating an anterior translation force on the femoral condyles. We have seen that there is during flexion what is happening, posterior rolling and anterior gliding. This anterior gliding is caused by this ACL. So here if you can see, this is the attachment. Okay, if this is the attachment, after reaching here, so the force, we have resolved the ACL force, and some of the forces which is creating anterior glide, this arrow mark. So this will cause the pull of the femoral condyles onto the anterior side. Okay, that is the function of this anterior cruciate ligaments. Okay, during weight bearing knee extension, the femoral condyles roll anteriorly on the tibial plateau in this way. So then what will happen? This one is checked by the posterior cruciate ligament. Okay, and this will create posterior translation on the femoral condyles. Okay, during weight bearing knee extension, the femoral condyles roll anteriorly on the tibial plateau. Up to how much? Until these posterior cruciate ligaments become rigid. Okay. So after rigid, what is happened? The tension is created in the posterior cruciate ligaments. So once the tension is created, it becomes taut. It becomes tightened. So then what is happened? Here the force is created. So then it causes posterior gliding, posterior translation force on the femoral condyles, which causes posterior gliding of the femoral condyle during extension. Okay, so this is the thing which this is the role of cruciate ligaments during flexion and extension. Okay, and this anterior glide of the femur, so when it occurs, anterior glide of the femur during flexion. Yes, very good. Yes, the anterior glide of the femur during weight bearing flexion may be further facilitated by the shape of the menisci also. It also depends upon the shape of the menisci, because the menisci create a circular wedge around the tibial plateaus as the femoral condyles roll posteriorly on the tibial plateau. Okay. So that means when it rolls posteriorly, it creates a wedge. Okay, it creates a wedge around the tibial plateaus. Okay, it creates a wedge around the tibial plateaus. They must roll uphill. So they must roll uphill with weight bearing knee flexion. Okay, they must roll uphill with weight bearing knee flexion. Okay, here the oblique contact. Okay, the oblique contact force of the menisci on femur. So here you have to see menisci on femur. This is the force, resultant force. Menisci on femur. Menisci on the femur deforms the menisci posteriorly on the tibial plateau. Okay. So the posterior deformation of the menisci occurs because the rigid attachments of the meniscal horns limit the ability of the menisci to move in its entirety. Okay. And this posterior deformation also allows the menisci to remain beneath the rounded femoral condyles. Okay, as the condyles move on the relatively flat tibial plateau. Okay, here because of this contact, so this meniscus has deformed. Okay, now it's okay, that is meniscus on the femur. Okay, this creates it, and also not only it the menisci deforms, and this one creates, this contact creates some shear force which helps in the anterior gliding of the femur. Okay, anterior gliding of the femur during flexion. Okay. So as the knee joint begins to return to extension from full flexion, the posterior margins of the menisci return to neutral. Again, this deformation of the menisci will again come to neutral position when the femur starts when the knee joint begins to extension. Okay, the motion of the menisci is an important component of tibiofemoral flexion and extension. Okay, and also here the need of the menisci is to reduce friction and absorb the forces of the femoral condyles that are imposed on the relatively small tibial plateaus. The menisci must remain beneath the femoral condyles to continue their function. The posterior deformation of the menisci during flexion is assisted by muscular mechanisms to ensure that appropriate meniscal motion occurs. Okay. During knee flexion, for example, if you can see here, yes, so it is going to posteriorly deformed, isn't it? So what happens during knee flexion, for example, the semimembranosus muscle exerts a posterior pull on the medial meniscus, whereas the popliteus muscle assists with posterior deformation of the lateral meniscus. Okay, these are the things which are going to happen during flexion and extension. Okay, this is about the arthrokinematics of the knee joint during flexion and extension. Now, in the next session, we are going to discuss about this locking and unlocking mechanism of the knee joint. Okay, thank you.